Good afternoon, Ipswich. I am Tony Marino. I'm your town manager, and we're here with our weekly COVID-19 update. We've got a great lineup today as far as information pieces go. We've got the standard lineup with the school department, Sheila Taylor with our Council on Aging, and Colleen Fermon, Public Health, and also Chris Bevilacqua will be here to give an update on what's going on with the YMCA. But we do have two more additions this week. We have two members of our Board of Health who will be joining us, and we're excited about that. And they'll be giving us an update, some update on specific COVID-19 questions and also questions about the tracing program. So we're looking forward to that. With regard to cases, I believe right now the town of Ipswich is at 62 total cases. Again, many are already out of quarantine. I believe we have 25 active cases right now. With regard to Town Hall will be opening tomorrow, limited schedule. We will be open 4 hours a day from 10 to 2. And 8 to 12 on Fridays. This Monday, today we're not obviously open, and then next Monday being Memorial Day, we won't be open, but we will be open Tuesday through Friday for the next 2 weeks, 4 hours a day. And we have all sorts of safety precautions inside Town Hall, so I'll say be patient with us. We're with social distancing and the safety precautions of our staff and our customers, the residents. We just want to let everybody know it's a little different setup than what it normally was. You won't be able to just walk freely into offices as you did before. And there will be queued up areas for the treasurer collector's office with markings on the floor for spacing. And if it gets too busy, we'll be limiting the number of people that come in and out of Town Hall, similar to what they do at grocery stores and Home Depot and things like that. So we will be giving that a shot tomorrow. If you have any questions, feel free to call our office, but we will be open again tomorrow 10 to 2, and it will just be the main entrance in front of Town Hall. The two side entrances will remain locked, and all the traffic will come through the main entrance. People will be allowed to egress out the side doors, but entrance will have to be coming through the main door. The governor's order today, being May 18th, they are starting the slow rollout, the phase that we've talked about, we thought was coming, and it is. With regard to businesses. Essential businesses are already opening. They can remain open, obviously, and will continue to stay open, but he's also opened it up to manufacturing, construction that wasn't already open. Retail curbside for pickup only. Places of worship, 40% occupancy limit on that, and they are recommending outdoor services when available and if possible. And then firearm retailers and shooting ranges as of today. Starting on May 25th, there will be opening up laboratories and life science facilities. Office spaces limited to less than 25% maximum occupancy, and then work from home is strongly encouraged. Car washes, exterior and self-service only. Hair salons, barbershops by appointment only. Pet grooming by appointment only, curbside drop-off and pickup. And certain outdoor recreational facilities and activities. And again, that's next week, Monday, May 25th, which is Memorial Day. We're still waiting to hear about the beaches. We were under the impression that that was going to happen sooner, but they are having another press conference tomorrow, so maybe they'll give us some additional guidance on beaches, because Cranes does have a plan, as everybody knows, to open on a limited capacity with their parking lot and reserving time slots, so more to follow on that. Keep an eye on our website and the trustees' website for more updates on that beach opening. Right now, I'm going to pass it over to Dr. Brian Blake. He's going to give us a quick recap of what's going on with the schools, and then we'll keep moving from there. Thank you.
Good afternoon. Thank you, Tony. Just a few updates and reminders for this week. Plans are coming together to celebrate our students at the end of the year. At the high school, there's a faculty and staff parade to honor the class of 2020 this Thursday, May 21st, starting at 4:30. And there is a planned route that they'll be following through town, and hopefully they'll catch just about all the graduates along the way. Graduation is planned for June 13th at the Crane Beach non-resident parking lot at 8:30 p.m. And the senior baccalaureate ceremony will be pre-recorded and broadcast via ICAM. More information will be forthcoming for all of those events. At the middle level, plans are in the works for a drive-up celebration of our 8th graders on Tuesday, June 16th. And again, more details will be forthcoming. And the elementary schools are both working on a moving on celebration for their 5th graders, with dates and specifics yet to be determined. We're working to put safeguards in place to be able to open our central office for the school district to the public on a limited basis beginning next week. There have not been any final decisions made as of today regarding our summer school program or our extended school year services for special education students. We're not sure if we're going to be able to do that in person or if that's going to continue to be virtually done. There is a group formed at the state level to provide recommendations for the reopening of school in the fall. And our school facilities working group of the school committee is also shifting its focus to the reopening of schools in the fall. This morning, we opened the portal to allow parents to register their children for the EDP program in the fall, with the understanding that we don't know what the program will necessarily look like, given the social distancing measures that we may need, or how many students we'll be able to accommodate, but we are accepting all the registrations at this point, and the registration fee has been waived for now. Our food service program continues to provide meals for any students in need, not just those eligible. Meal delivery locations and times are the same. Rosewood from 11:30 to 12:30, the Winthrop School from 11:30 to 12:30, Agawam Village from 11:30 to 12:15, and the Powder House Village from 12:15 to 12:30. And that wraps it up for this week. We do have a school committee meeting on Thursday night if you'd like to join in and watch.
All right, great. Thank you, Brian. And that actually reminded me, as we do have a select board meeting tonight, May 18th. That is on the Zoom. Login information is on the agenda, which is posted on the town website, and that meeting starts at 7. So right now I'm going to bring in Sheila Taylor, our Council on Aging Director, to give us an idea of what's going on with the seniors in town and the services that they offer.
Thank you, Tony. So as we all know, and we're all very glad for, Town Hall is opening tomorrow for us, which is Tuesday, May 19th. And the Council on Aging remains open, fully staffed. We have been open since the beginning, providing essential services that have included grab-and-go meals, volunteers to help with grocery shopping, prescription pickup, reassurance calls, and outreach. So, and the van service too. So the Council on Aging has been open, but the senior center has not been open. And unfortunately, and I can't say it more than for me, does not make me happy either, we need to remain closed for a while. I have not yet heard the governor's speech, but I'm expecting that we are probably in phase 3 of the reopening. So anything we do must be done intelligently and slowly and gradually. So what we plan to do, and this is all very fluid, so I'm not even going to give any dates, is that once we're able to reopen on a very small scale, we will be able to have people to come in by appointment only, stay with us for a short while, maybe an hour or two, to visit with friends, and socialize. Really, that is the piece that we have all been missing. So we want to get that back as soon as possible, but we will just have to wait for it to be the right time. So once that happens, though, we will have people call ahead, make an appointment. The van can bring people over, or people can come, but hang out. We expect we will set up 2 lounges, the cafeteria, which many of you know is wonderful space. We will set that up with some of the couches from the lounge, so that we'll have 2 areas for people, so that it can be everybody can be socially distanced and happy. So we're looking forward to that, and we will let you all know as soon as we have a plan, when we know that that can be safe. I will most likely let people know by robocall. That's the quickest way to let people know, and through our website and Facebook page. That said, too, our June newsletter, I'm working on it right now, so that will probably go out next week. We're going to be introducing a lot of new programming, both online, through Zoom, maybe Facebook Live. We're still seeing if that is a good option for us. And also do some presentations, some educational presentations. It seems people are missing that, so we're going to look forward to that. We're having our second Zoom meeting this week with a group of people, and it was really a lot of fun last week, so we're looking forward to that again. So that said, I cannot say enough about my staff that has helped us get through these last 10 weeks with barely a beat missed. We have had to revise almost every single thing we do as a Council on Aging, and we are still doing that on a daily basis. And without my wonderful staff, we would be lost. Some councils on aging have not been able to keep up and offer the services that we've been doing. So we're really fortunate to have the support of the town manager and the select board and finance committee, and then also volunteers that have helped us make all these programs happen too. So between town government, staff, and volunteers, we are a wonderful community, and we're so fortunate to be able to offer these services. So I wanted to make sure I said that. Then the last thing I just want to say is the grab-and-go meals will continue. This is, I think, the 8th week that we've been doing that. We have this week and next week to go 5 days a week. The last day for 5 days will be Friday, May 29th, and then after that, on Monday, June 1st, we're going to decrease it down to 3 days a week. Still working out the details of the days, but that will come, and the people that are involved in the program, we will let you know. But we'll go down to 3 days a week. We think this is a nice time to transition the change, and people are all fine with that. So, but we thank Pomodori and Senior Care for helping us make that happen. So thank you very much for all your support.
All right, great. Thank you, Sheila. And I will echo the sentiments that you laid out there for your staff. Both you and your staff have been amazing through this entire process, and I do want to thank you for that. You guys have been great. We could not have done everything we did without your staff, so they were amazing. Thank you. All right, and up next, we have Chris Bevilacqua from the YMCA. He will give us an update on what's going on with the programs over there.
Thanks, Tony. Over at the YMCA, we are continuing to move ahead. After today's press conference from the governor, we've had a little more clarity as to process and what will be coming down the pike. So our emergency childcare is going to continue. We continue to run that at our locations in Beverly, Salem, and Haverhill. As new sectors of the economy open with each phase, as announced by the governor, we expect to see demand grow. So we're ready for it, and you know, when we get the go-ahead to open more childcare in subsequent phases, we'll be ready. That said, in preparation for opening camp, we're continuing to work to ensure that we provide a safe, fun camp experience for kids in Ipswich this summer. So again, it looks like camp is going to be included in these phases, so we're continuing to prep and make sure that we're ready to go. Our planning includes finalizing sanitation, staff training, and activity plans based on the guidelines provided by the state for both our Cedar Mill and Camp Dory locations. We're excited about the prospect of being able to hold camp again. We're really excited to see the kids and, you know, just support families and you know, get these kids outside and give them something fun to do. So really excited and looking forward to that. Again, based on the state reopening guidelines, it looks as though our facility is listed in phase 3, which puts us out a little bit. We've got a few weeks to go there, but again, gives us time to finalize all of our sanitation and staffing plans in accordance with the guidelines handed down to make sure that we've got a safe reopen for our members when the time comes. The prospect of outdoor classes possibly being allowed sooner was mentioned. So again, prepping for that, looking at our outdoor spaces to see how we can possibly offer some outdoor Group X classes should that opportunity arise and that become a possibility. Looks like the drive-in is becoming more of a real possibility. So again, we're ready to go with that. Hopefully host that over at the high school parking lot in conjunction with the town. We're going to circle back with the town and just finalize what date that might be, and then, you know, get that up and going, get that advertised. So be on the lookout, you know, Facebook and websites. As soon as we have a date for that, we will get it out and give everybody a little reprieve, get them outside. Or not outside, out of their house, in their cars, safely social distance, to see a movie with their family and kind of break up the monotony. Other than that, we're continuing with our Monday meal delivery. That's happening in collaboration with the Dinner Bell. I think, like I said, last week we're still at about 85 meals a week. That's been great. A lot of support from volunteers from some of the different churches in town and Rotary, as well as YMCA volunteers. So that's been going really well. The Tuesday meals have come to an end, unfortunately, but we are looking for support. We've got another possible donor in the pipeline, so looking to get those up and going again. We'll keep people posted on that. And we're continuing with the grocery deliveries on Wednesday and Thursday in collaboration with Open Door. So those continue to go again. Volunteers from the Y, from Rotary, and actually from vets associations all around coming out to help with those. So that's been really great, and we plan on continuing that into the future as long as the need presents itself, and, you know, as we kind of make our way through into the next phases of what's happening with the pandemic. And lastly, we're continuing with our free membership for 3-month membership for first responders, trying to keep them healthy and active as they continue to help us and keep us all safe and healthy in the face of this pandemic. So again, just kind of continuing the work we're doing and continuing planning with the hopes of being able to open up some camp and facility in the near future.
All right, great. Thank you, Chris. We appreciate the updates and the collaboration and partnership with the YMCA. I am going to be passing the rest of the meeting off now to Colleen Fermon, our Public Health Director. As I said, we've got some special guests today from the Board of Health, and they will be on to give us an update on what's going on with COVID-19 and answer some questions that not only the board's been getting, but other questions through social media. So we're excited about that. I would remind everybody that tonight we do have the Select Board meeting at 7 o'clock. I would advise everybody, please tune in. They'll be talking about not only cuts to the budget that we're making due to COVID-19, but also to go over the impacts that it'll have on town meeting. And as we plan for that in June, the board will be deciding whether or not to pick a date and plan that, and also what the warrant's going to look like. And that information is available in the Select Board meeting packet on the website. As Sheila spoke about earlier, the COA will not be having people back in the COA right away. The same is going to be true for the library. The library will have a slower rollout than we are at Town Hall. Given the number of programs and services that they offer, it obviously needs to be done in a coordinated fashion. So they're shooting technically for June 1st, but again, that date's tentative right now. We have to get all the safety protocols in place. And once they do open and announce that that's the case, they'll only be doing book pickup and drop off. And they've got a nice plan and a map laid out for that, how that's going to look. But limited to just book, pick up and drop off in the beginning, and then we'll start to integrate more services in as this as we get to the additional phases here in the reopening plan that the governor laid out. So at this point, I'm going to pass it off to Colleen Fermon, our Public Health Director, and she will bring us home today. So thank you very much, Ipswich, and here is Colleen.
Hello, Ipswich. So I just want to give you a case update. So currently we have 63 cases in Ipswich. 11 remain in isolation, which means they're still sick with symptoms. We have 69 contacts, but only 24 of those have to stay under quarantine currently. So that means the rest have been removed from quarantine and are doing better and can move around again. I just want to touch base on some changes happening versus COVID-19 testing. So originally we talked about symptoms, shortness of breath, and a fever and a cough. I want to make sure that you understand they're also seeing symptoms that have expanded to fatigue, sore throat, headache, body aches, loss of sense of taste or smell. So if you're experiencing those things, you do want to reach out to your provider. Additionally, as far as testing, there's a lot of talk about testing. So when people are confirmed to have COVID-19, they're using a PCR test. So you may have heard that. And that basically is what we want to use for diagnostic purposes. The antibody tests are not to be used for diagnostic purposes. So that is helpful in other arenas, but not to say whether or not you have the virus. If someone does have an antibody test and comes out positive, then it's recommended they follow up with a PCR test. A lot of this you'd go through with your own physician, so you don't have to, memorize this, but I just wanted to explain a few things that you may be hearing. Additionally, there's a big push in the state to try to do testing of close contacts. So close contacts would be someone that you spent 10 or more minutes with within 6 feet, or someone that maybe you've had direct contact with, unfortunately, let's say they've coughed on you and they're sick. So those close contacts, we usually have told to quarantine and check themselves for symptoms for 14 days. There's a big push now in the state to try to get those people tested. That way we know actually who is positive and would be moved to isolation parameters and who isn't. If it turns out you're under quarantine and you test negative, you still have to do your 14 days, but it just helps to identify who's actually carrying the virus and is sick with it. So I know there's a lot of questions regarding COVID-19. So we have today 2 Board of Health members. We have Dr. Susan Boreri, who's going to answer some questions she's been asked, and that'll be followed by Amanda Donovan. So we're going to start with Dr. Susan Boreri now to answer your questions.
Hello. My name's Susan Boreri, and I'm an emergency medicine physician. I've had the pleasure of working in emergency medicine for about 17 years. And over the past couple of weeks and months, I've had a lot of people in the community approach me and ask me some questions. So I've picked out about 7, which I think will be helpful, and I'm going to try and answer those now. The first question is how did COVID-19 get its name? It's from Karen on Linebrook Road. So COVID-19 is a breakdown for coronavirus disease, and it happened in 2019. If you look under an electron microscope at a coronavirus, it has a crown, hence the name corona, which also means halo. That's the disease name. The actual virus is called SARS-CoV-2, which gives opportunity for people in the medical field and also vaccine makers when they discuss different viruses to narrow in on a particular virus. The second question is, how is COVID-19 transmitted? And that came to us from Don on Agilla Road. So Don, it's transmitted on many different levels, which is why it's such an infectious and dangerous virus. First of all, droplets. Someone sneezes, the droplets can travel about 6 feet, which is why we like people to stay at least 6 feet away. It can also come out as aerosol, so talking. You can have small particles, which can actually stay up in the air for up to 3 hours. It also can be transmitted on surfaces. Hard surfaces like stainless steel can contain a live virus for up to 3 days. So cleaning with disinfectant in common areas such as doorknobs, bathrooms, tabletops are essential to help curb the virus. There's been some concern about the virus being transmitted on plastic. Some studies are done aboard the cruise ships, which had extensive quarantine, show it can be on plastic up to 14 days, but we know that the virus may not have any potency by that time, and also on cardboard up to 24 hours. We know now that the virus can also be transmitted through fecal particles, so essential if you're taking care of someone who's home or sick, and helping with their bathing and maintaining that you wash your hands. And basically this goes down to cleaning surfaces that are commonly used and washing your hands. The third question is, if I get infected, how many days till I actually get sick? And that came to us from John on High Street. So John, that's a great question. Some people can get the virus and not show any symptoms. Some people can get the virus and get symptomatic up to 14 days. The majority of the people start feeling symptoms around day 4 or day 5, which is why the self-isolation and quarantine for the 14 days is a really important aspect of conquering this disease. The next question is, what are the symptoms of COVID? So the symptoms have changed. Initially, the virus we thought was more respiratory, but we know now that it has many aspects, as Colleen just explained. Fever over 100.4 for greater than 3 days, although we're seeing people in the emergency room with very high fevers, 103. Cough, normally a dry cough, which can start with before the fever, after the fever, can last up to a month. Headache, a lot of people are coming in just with fever, abdominal pain, nausea, vomiting, and diarrhea. Some people were seeing a particular type of rash called a vasculitis, which is pathognomonic of the disease, especially in children, and we'll talk about children, as well as fatigue. A lot of people just say they feel tired, they can't do things they normally do. We're also seeing people who come in with bloodshot red eyes, and because it's a respiratory virus, we see some people with sore throat. So this can, there's many aspects of this virus. So if you have any of these symptoms, even just fatigue, you should reach out to your primary care physician to discuss your symptoms and possibly get tested. And remember, people can have the virus and be asymptomatic, not have any of these symptoms, and still transmit the virus. The next question comes from Wendy on High Street. Is it safe to go back to the emergency room? Wendy, this is a great question. We've made a big effort in the emergency room and the hospitals to separate the COVID patients from the non-COVID patients. If you're sick, if you have chest pain, shortness of breath, headache, any kind of symptoms that you feel you need to be evaluated, we want you to come to the emergency room. You are triaged, and if we think you have COVID-like symptoms, we put you in one part of the emergency room where you're separate from other people. If you don't, you're in what we call the clean part of the emergency room, where you're not around anyone who has COVID. The staff at the hospital and the emergency room in particular are very versed in how to use PPE to keep them safe as well as you safe. So don't stay home if you feel like you need to be seen by an emergency room physician for any symptoms, because we're there to take care of you, plus it's very safe to go into the emergency room. Another question is, can you talk about coronavirus in children? This comes from Teresa on Pearly Ave. So Teresa, we have a new aspect of coronavirus that's hitting children. We call it multisystem inflammatory syndrome. There's a disease called Kawasaki, which happens normally in the spring and the fall, where kids can get fevers, very large swollen tongues, lips, bloodshot eyes. And this particular Kawasaki's disease has a predilection for the heart. We found now that there's kids who had COVID, had no symptoms or mild symptoms of a cold, and then months later can get this multisystem inflammatory disease syndrome. It can occur from birth up to 19 years of age, and its classic presentation is fever. They can also have these rash, which can be on the lower and upper extremities, and nausea, vomiting, and diarrhea. They often have very red lips, and we call strawberry tongue or bloodshot eyes. If your child has any of these symptoms, it's very important to reach out to the pediatrician because if this disease goes untreated, as like Kawasaki, it can have a problem with the heart. For some reason, the virus likes the heart, and it can cause problems with the heart, including heart failure and valve disease. So if your child has a persistent fever, a rash that's concerning, or any of the symptoms that we talked about, we want you to reach out to the pediatrician, or certainly feel free to come to the emergency room to be evaluated. And so that does my portion of the taping. I just want to say thank you, everyone in Ipswich, for abiding by the rules to help keep the healthcare workers safe, as well as your community members safe. Thank you.
The next Board of Health member, Amanda Donovan.
Hi, I'm Amanda Donovan with the Board of Health, Ipswich, Massachusetts, and I'm here to answer some questions that people submitted about contact tracing. The first question we got is from Ben on Argilla Road, and he asked, what is contact tracing and how does it work? So contact tracing has been around for a very long time. It first started during the bubonic plague and Dubrovnik and has continued through the centuries. This effort that we're doing now is much larger than anything we've done before, but there are other diseases that we have traced, such as tuberculosis, that, if you get a positive diagnosis, someone will follow up with you on that. So this is a large-scale project eventually. So basically what happens is if you go and get a test and you test positive, then that goes through the state lab, and then the phone number and name and address that you have attached to that test will come to the contact tracers, and you'll get a phone call on the caller ID. It comes up as Mass COVID Team, and you answer the phone call, and it starts with a case interview. It could take a very long time. You can break it up into a couple conversations if that's easier for you. It could be about an hour where the person talks to you about your symptoms and what to expect, answers any questions you might have, and then they're also going to ask for any contacts you've had with other people. So they're going to walk you back through your timeline over the past couple of days before you tested positive or started showing symptoms, and they're going to get those people's names and numbers and answer any questions you might have, make sure that you're going to be safe, isolating. They're going to give you information about what isolation means. And then after that, the contacts get notified. So anyone that you've had prolonged contact with, we're saying about 15 minutes of contact, less than 6 feet apart, we'll be following up with those people and notify them that they've been exposed to COVID, but we do not give your name. So it's all going to be completely anonymous. And we're going to walk those folks through how to get a test, where they can access a test, and how they can quarantine at home and monitor their symptoms. And there's going to be follow-ups. So somebody might be calling you every day to sort of check in, see if you've developed any symptoms, see if you have any questions, and if you have any needs. Part of contact tracing is supporting people who are in quarantine and isolation. So they'll be asking if you have enough food to get through the week, if you have kids that need some help, if you need help with your rent payments or applying for unemployment. People are going to ask you questions, and you are welcome to answer them or not, but help is there to help support you to stay at home during that period of time. So that's about it, I think, for what contact tracing is. How we do it, I think I went into a little bit of that. So Peg asked from Mitchell Road if we use social media for contact tracing, if we look people up on Facebook and Instagram, and we do not. So the only information that we get is the information that you give when, to your doctor or when you go to get your test done. So we have that demographic information, your address and phone number, but we do not look up on social media to see if there's pictures of you at the grocery store or anything like that. You are more than welcome to deny, to not answer any of the questions that are asked of you. And you're not required to participate, although it is strongly encouraged. Third question that we have is, if we can't reach somebody, do we send the police to their door? And that is from Patrick on Mitchell's. And the answer is no. We do not. We don't work with the police to enforce contact tracing. It's a completely volunteer program. It is very helpful, and contact tracing is very effective when people participate in it, but it's not going to be enforced by law enforcement. The next question is from Larry on Short Street, and says, if I was exposed and I have to go to work because I'm an essential worker, what do I do? So the contact tracers that call you will help you walk you through that. If you've been exposed, you need to quarantine for about 14 days. It would be good if you could get a test, but it's not necessary. You can just stay home and monitor your symptoms. But during that time, you shouldn't go to work, no. And we can help with giving a letter from the DPH for your employer that's, talks a little bit about employer rights and employee rights and what quarantine means. And the contact tracer can help you walk through that. But you should not be going to work. And related to that question, Karen on Turkey Shore asked, if you're on quarantine, can you still go to the grocery store? And the answer is also no to that. So if you've been exposed, if you have a confirmed exposure and you have to stay home for 2 weeks, you can't go to the grocery store. You shouldn't leave your house. So if there's things that you need at the grocery store, there's a few different options. And again, the contact tracers can help you work through that. There's a few options. If you have the means to use Instacart or some kind of grocery delivery service, then that's encouraged. If you don't have the means to do that or can't get an appointment, I know that they've been backed up, then you can have a friend or family or neighbor run to the grocery store for you, text them your list, Venmo or PayPal some money to them, and they can just leave the groceries for you on your doorstep, and that's perfectly acceptable. If you don't have anyone that can run to the store for you, or if you don't have the means to get groceries yourself, we have the Open Door Food Pantry here in Ipswich, and they are open Wednesdays and Thursdays, and they're phenomenal. Their phone number is 978-283-6776, and they can give you some help and guidance on what they're able to offer right now. You can also call the Board of Health through the town website, and we can help get some food delivered to you if that's something that you need. So please try not to leave your house if the contact tracers suggest that you quarantine, and there's a lot of people out there that are able to help you stay safe during that time. The next question is from Susan on Linebrook. Do I need a negative COVID test to leave my house after the 14 days? You do not need the COVID test, but you should defer to your PCP or your employer or the contact tracers about when you can be cleared from isolation or from quarantine. The criteria can be a little bit different depending on each situation. So some employers are requiring a negative test to return to work. Some PCPs are not able to offer a test, but if you're symptom-free and it's been 14 days, they might let you go. So just defer to the people who were caring for you during this time. And again, contact tracing, in their follow-up, you can ask some of these questions and they can help guide you through that process. So last question is, how long will the contact tracing program last? And that's, I don't have an answer for that. Hopefully it won't go on forever. Although, like I said earlier, there are some diseases that we still follow up on, and this might be one of them. The program is very large right now, but hopefully if people follow safe social distancing and wear masks in public and remain safe, then our numbers are going to continue to go down and we won't have much need for this program. But we'll see, and stay safe, stay healthy, and take care of each other. Thank you.